I have gotten frustrated when I went to companies and said, like, come on, give me a per employee per month norm and then help me understand how to benchmark what changing this would do, what changing this would do. No one will give you that data. The data is not available. I would like to say that over the next 5 years, being that we're just rolling some of these plans out, over the next 5 years, I think we'll have that data because nobody's tracking that. And it's amazing to me that nobody seems to be interested in it. And so many people will say stuff to you like, we have tons of data, but I've asked for this sort of data and can't get it anywhere no matter what. But you have to realize that the incentives of the industry are not, when you have a health broker that's selling you a plan, they have 50 conflicts of interest that they're dealing with, like their retention bonus with Aetna and whatever. You know, I'm not trying to knock health brokers. Like, your broker can participate in our plans too. It's just the commission might not be up to the level that they're used to because we're cutting those costs out. Because we put the plans together pre-advised. We're not looking for a million things, and I don't think that most brokers provide that anyway. The adjustments are superficial in nature. You know, ours are deep. So I think that it's out of the depth of what most people are going to offer. Anyway, I think that if you wanted to understand, like, here's what I'm doing today, here's what it costs, and here's what it would cost if I did something different, I don't think that data exists. Nobody's looking at what happens if you start pushing your employees to critically consider their health care, or if you restructure your plan document to work harder to have the company and the employee go first dollar and the insurance to go much later. Like, that's how insurance should operate, but it's not how this field operates. So the data doesn't exist because, like, I don't want to sound like a jerk. It's just nobody's doing that. So, you know, we're pushing in a new space. And if you watch this video and you think that's not true, come to me and show me how we can do it easier. I'd be so happy to just adopt somebody. That's what we first tried to just say, hey, we'll just adopt someone else's solution. But it didn't exist, and I believe that it doesn't exist by and large. Even the most cutting edge people that I'm working with, these captive insurance providers that are trying to figure out how to carve up the marketplace so that smaller employers can self-fund, I've still had to push with all my might to get them to consider open-mindedly other ideas, you know, outside of we're just going to keep doing the status quo. So that's it's extremely challenging to consider, if I started doing these things, what would happen to my claims cost. But the answer is they can't go up. I mean, currently we're dealing with the marketplace that we already just go to the doctor for everything and pay for everything and ask no questions whatsoever. So there is, I think we're overt about saying the point of our plan documents is to push behavioral changes by making people accountable for some level of consideration in, is this necessary? What should I do for healthcare? And I keep reiterating, I don't want people to think that I'm evil for saying that, because you should never consider the cost of healthcare when considering healthcare, because there's no world where the healthcare doesn't have a cost and we all pay it. So consider it now, or consider it when you inconsiderately pay your huge healthcare bill. But like, there's no other option. So anyway, that data truly doesn't exist. So